Hi everyone, Dr. Emma Foraker here at North Point Aesthetics in North Glen, Colorado, and today I'm going to talk to you about sculptra. I'm going to show you how I dilute my sculptra and talk a little bit about sculptra for the neck, which is an amazing treatment, but you have to be really careful about it. So I'm just going to go ahead and get started here. So I use saline for dilution. Technically the common knowledge is that you're supposed to use sterile water for sculptra, but I've had absolutely no issues using saline, and I just find it to be easier for stock and supply issues. So I usually do a full vial of sculptra. I dilute the sculptra to exactly the amount that can fit into the vial, and I'm doing this 24 hours in advance. My patient is scheduled for 2 vials of sculptra tomorrow morning. So I'm gonna go ahead and maybe I'll just move my phone so you can get a better view of how I'm doing this, but I'm literally just got my alcohol swab here, and I'm literally just filling the sculptra to its capacity. And it's gonna give you a little bit of resistance to try to fill it up, but literally that's all I do. And then I let it sit, and then when I'm gonna actually use it, I am gonna mix it with lidocaine. And I do that by just drawing out the sculptra from the vial and then using a Luer lock connector to connect the two syringes. And then I usually put about, 2 to 3 cc's of lidocaine per sculptra vial. It depends on exactly where we're doing it. You know, the face obviously is a little bit more tender, so I'm gonna use more lidocaine for that treatment, just not only for the treatment itself. Obviously, we also would do topical numbing or like pilot hole numbing if we're using a cannula. But I also like to mix the lidocaine in with the sculptra, and that's just because sculptra can be a little bit sore for a few days. When you're doing your massages after you've gotten sculptra, you know, it can just be a little bit achy and sore. And so what I want to talk about today, though, is sculptra for the neck. So we used to never even use sculptra in high movement areas because we were so concerned about nodules. But now we realize that sculptra for crepey neck skin is actually a wonderful treatment. It's just that you have to make sure you are diluting it. And like I said, I've diluted it to, it's approximately, maybe 9 cc's if I were to fill a whole bottle, maybe 10 cc's if I fill the vial up. And I've not had any nodules, and I've put it in my own neck and other, patients' necks, and it is fine to do that. And so it's actually a great treatment. So I think we used to be kind of scared about the potential for nodules, and everyone talks about it, but the risk of nodules are actually extremely, extremely rare. So, yeah, here we go. I'm gonna dilute my second vial of the sculptra. And so I've got my saline here, and in we go. Just got sprayed. So that can happen because it's under a lot of pressure, but I filled it completely to the top. And so now I shake it a little bit, and definitely once I'm using it tomorrow, we have to resuspend those particles in the saline. So obviously I'm constantly shaking it. I'm shaking it right before I go to inject it, because again, we don't want those little tiny particles of the PLLA to clump. And so by, resuspending it, often and right before we inject, we're making sure that we're, getting the sculptra evenly distributed. And so that's a very important piece for not getting nodules, because if you have it, obviously, if it's all clumped and precipitated into one little ball and then you inject it, that's obviously going to be more likely to form a nodule there. So okay, so that is how you dilute your vials of sculptra, get them ready for injection. And then tomorrow what I'm going to do is use a cannula, or you could use a needle and do what, I've heard it called the neck wash by Dr. K, who's a plastic surgeon in the field. But basically you literally just inject it all over. You create a nice even distribution of the sculptra in the neck, and kind of focusing on where the front neck was where usually people have the most crepey skin, and make sure that they're doing their 5-5-5 rule massages 5 minutes per day, 5 times a day for 5 minutes at a time. Did I say that correctly? Yes. And make sure they're doing, you know, good massages. Using a cream or a gua sha tool is really helpful for that, to make sure that, again, we're kind of helping that Sculptra to distribute and create collagen in a very uniform fashion, as opposed to clumping in different areas and, you know, that kind of thing. So if you have any questions about Sculptra dilution or Sculptra in the neck, please let me know in the comments below, and I hope you have a good day.